All right, let's dive right in to this deep dive specifically for neurologists facing ATTR-CM.
You got it.
We're breaking down the HELIOS-B trial
Straight from the New England Journal of Medicine.
with a laser focus on the data and percentages that matter most in your practice.
Absolutely.
Now, ATTR-CM,
Yeah,
this is a tough one.
it is.
Misfolded transthyretin protein building up,
Right.
leading to a median survival of just 2 to 6 years after diagnosis.
Unfortunately, that's the reality.
And even with tafamidis, which is a currently approved treatment,
Yeah.
the mortality rate is still way too high.
Still a big problem.
Now, this is where vutrisiran enters the picture.
Okay.
It's administered subcutaneously,
Right.
and it's an RNA interference therapeutic agent.
Interesting.
It actually tackles the root cause by blocking the production of that transthyretin protein in the liver.
So preventing amyloid formation.
Exactly.
I see.
Now, it's shown some real promise in hereditary ATTR amyloidosis with polyneuropathy.
Yeah, I've seen that.
And that's what sparked the investigation into its potential for ATTR-CM.
Makes sense.
So the HELIOS-B trial,
Okay.
this was a double-blind, randomized, placebo-controlled study.
The gold standard.
Enrolled 655 patients
Wow, that's a good size.
with both wild-type and variant ATTR-CM,
Important to note.
which is really relevant for neurologists because
That's
we often see a mix of those subtypes.
For sure.
So in the trial, patients were randomized 1.1
Right.
to receive vutrisiran or a placebo
Okay.
every 12 weeks for 36 months.
I got it.
And importantly, they included patients both on and off tafamidis at baseline.
Oh, interesting. So reflecting real-world practice.
Exactly.
Oh, makes sense.
So getting into the results,
It's an exciting part.
the primary endpoint was a composite of death from any cause and recurrent cardiovascular events.
Right.
And this is where the numbers get really interesting.
Okay, I'm all ears.
The hazard ratio for that primary endpoint
Mm-hmm.
was 0.72,
Okay.
meaning a 28% reduction in risk with vutrisiran compared to placebo.
That's significant,
It is.
especially for such a serious condition.
Absolutely. And for those not taking tafamidis at baseline,
Yeah,
the hazard ratio was even more impressive,
let's hear it.
0.67,
Okay.
a 33% risk reduction.
Wow, that's very promising.
It is.
Okay.
So those are some really impressive numbers.
They are.
But let's dig deeper into the impact on mortality,
Right.
because that's a major concern,
Of course.
especially for us neurologists.
Absolutely.
So over a follow-up of 42 months,
Okay.
vutrisiran showed a significant reduction in the risk of death from any cause.
How significant are we talking?
Well, the hazard ratio was 0.65.
Okay.
So that translates to a 35% reduction in mortality risk.
That's a game changer.
It is.
Potentially adding years to our patients' lives.
Exactly. And beyond just survival,
Yeah,
we also want to improve their quality of life.
absolutely.
So functional capacity is a big part of that.
Right.
They use the 6-minute walk test for that
Okay.
and the KCCQ-OS to assess quality of life.
Got it.
Now, both groups
Yeah.
did experience declines in these measures over time.
Makes sense. It is a progressive disease.
Right. But the decline was much smaller in the vutrisiran group.
Interesting how much smaller.
Well, in the 6-minute walk test,
Yeah.
there was a difference of 26.5 meters
Wow.
favoring vutrisiran.
That's pretty substantial.
It is.
Suggests they were able to maintain their ability to do everyday things better.
Exactly.
And what about quality of life?
The KCCQ-OS showed a difference of 5.8 points,
Okay.
also favoring vutrisiran.
So both measures pointing towards a benefit for vutrisiran.
Right.
Now we have to remember that this trial mainly focused on cardiac outcomes. So as neurologists,
Right.
we know that ATTR is a systemic disease,
It is.
often affecting the nervous system as well.
It does.
So it makes you wonder,
Yeah.
could vutrisiran have neuroprotective effects?
That's the big question.
Especially since many of our patients
Yeah.
present with both cardiac and neurological issues.
That mixed phenotype. So could early intervention with vutrisiran actually protect their neurological function?
It's definitely an area that needs more research.
We need trials specifically designed with neurologists in mind,
Absolutely.
evaluating neurological endpoints. Imagine trials looking at
Yeah.
progression of neuropathy,
Yeah.
cognitive decline,
Important,
autonomic dysfunction,
all crucial aspects for these patients.
and maybe even biomarkers
Right.
to predict which patients would benefit most from vutrisiran's potential neuroprotective effects.
That would allow for personalized treatment strategies.
Exactly.
So much potential here.
There is.
But for now, let's talk safety,
Okay.
because that's crucial in our decision-making.
It is. We need to know these treatments are safe long-term.
Right. And the good news is the Helios-B trial showed a really good safety profile for vutrisiran.
That's reassuring.
The incidence of adverse events was similar in both the treatment and placebo groups.
That's great. Were there any specific adverse events that we should be aware of?
The most common were injection site reactions,
Okay.
but usually mild and temporary.
Nothing serious.
No significant differences in liver or kidney function between the groups.
That's great to hear, especially when we're thinking long-term treatment.
Right, exactly.
So this trial really seems like it could change things for managing ATTR-CM.
Yeah, it really feels like a paradigm shift.
Moving beyond just managing symptoms.
And actually getting at the root of the problem.
That production of misfolded TTR proteins.
Exactly.
So with vutrisiran and other RNA interference therapies, it's not just about treating the disease.
It's about potentially changing its course.
Being proactive.
Preventing or slowing down that progression.
Rather than reacting to the consequences.
Which can be devastating for these patients.
And as research continues,
Yeah.
we're hoping to see even more targeted therapies.
Leading to better outcomes.
And a brighter outlook for our patients with ATTR-CM.
Absolutely.
So this deep dive was really a focused look at the Helios-B trial.
Highlighting the data that's most relevant for neurologists.
And we definitely encourage you to check out the full article.
In the New England Journal of Medicine.
To really get a deep understanding of everything they found.
And as you take this new knowledge into your practice, remember this is just the start.
The beginning of something new.
We're going to see more research on vutrisiran and other promising treatments.
It's an exciting time.
It is so stay informed, stay curious.
And keep pushing those boundaries.
For your patients with ATTR-CM.
Thanks for joining us on the deep dive.
It's been a pleasure.